I have been dispatched to a 23-year-old woman who has a GSW to the leg at DuPont Circle. I am arriving at scene. I do not feel like the scene is safe, so I'm going to call law enforcement for backup. Law enforcement has come, they have cleared the scene, and everything is safe. I have my PPE on. I only see one patient. Mechanism of injury is a GSW to her right leg. And I'm going to do C-spine immobilization. Fireman said is going to do C-spine immobilization. Hey, can you hear me? Alright, so she is responsive to vocal stimuli. Hey, can you hear me? My name is Kelly Fisher and I'm one of the EMTs. Can you please tell me what your name is?
It's Meg.
Okay, can you please tell me what day it is?
Wednesday 7th.
Okay, can you please tell me where you are?
Big Bird's Nest.
Alright, and can you please tell me the events leading up to it?
I was out eating and I got shot when I came out of the meat place.
Okay, so she has a learn-oriented times 3. She did not know where she was. Alright, so I'm going to control the bleeding by putting direct pressure on the wound. It's going to hurt a little bit, okay? And I'm going to apply a tourniquet. Alright?
Kelly.
So, twisting it. The blood seems to be slowing down, and now it has stopped. So now I'm going to assess her pulse.
Kelly, it's painful.
I know, we're going to get you to the hospital. Right, her pulse is very thready. I'm going to check her temperature and her skin. It's very clammy, moist, and cold, so I'm very worried about hypovolemic shock from the amount of blood loss, so I'm going to do shock management and put a blanket over her. And I'm going to assess the airway. Her airway is patent, so no need for oral adjuncts since she's alert and talking to me. And now I'm going to assess her breathing. Her breathing is shallow and slow, so I'm going to put her on nasal cannula and do 6 liters per minute. Transport decision, we're going to transport her right now. She is very critical from the amount of blood that has been lost. Alright, now we are in the ambulance. Alright, we're going to get this leg fixed, okay? But can you please answer a few questions for me?
I'll try.
Okay, what were you doing before the incident?
I was walking out of the restaurant and all of a sudden this guy hits me with his gun and then shoots me in the leg and runs off with like food.
Okay, can you please tell me what makes the pain better or worse?
It's better when I don't move and much worse when I rotate.
Okay, so we're just going to keep you still for right now, okay?
Thank you.
Okay, can you please tell me, can you please describe your symptoms? Is it like sharp, dull, crushing pain?
It's like a sharp pain in one spot.
Okay, can you please tell me from a scale of 0 to 10 how bad your pain is right now?
It's like a 13.
Okay, can you please tell me, does it radiate anywhere or does it just stay still?
It just stays still.
Okay, then one more question is, can you please tell me, is it constant or does it touch and go, the pain?
It's constant.
Okay, so now we are going to take her sample history. Alright, do you have any allergies?
Penicillin and eggs.
Alright, do you have any medication? Do you take any meds?
I just take Prozac for depression.
Okay, can you please tell me what your past medical history is?
Yeah, depression along with anxiety and hyperthyroidism.
Okay, can you please tell me when your last oral intake is?
I don't know how long ago, but at the restaurant.
Okay, can you please tell me again what happened?
Thanks. I got shot in the leg.
Okay,
Beat up on.
Yes, so I'm going to take your vitals now. I'm going to take your pulse.
Okay. Oh.
Okay, so that's a little tenderness right there.
Yeah.
Alright, so you have a pulse of 128. So your tachycardia, probably from the amount of blood loss. Okay, I'm going to check your respirations now. Your breaths are slow and shallow. And you are breathing about 9 breaths per minute. So we're going to keep the oxygen on you, and hopefully that improves. Right, now we're going to put the pulse ox on. Put the pulse ox on. So your pulse is 85. Alright, so we're going to keep that oxygen flowing, alright?
Okay.
Alright, so now I'm going to do a full head to toe secondary assessment on you, okay? Alright, we're going to start with your scalp. Looking for decap BTLS, okay? Moving down to your cheekbones. Looking for tenderness, going to your mandible. Okay, you okay, alright. Looking in the eyes. Alright, they are equal. Looking in your ears, up your nose, other ear. Alright, so no fluids or blood coming out, so I'm not worried about CSF. Alright, so now I'm going to go down to your throat, looking for any trachea, jugular JVD. Doesn't seem to have any. Your trachea is midline. Alright, checking for your cervical spine. Everything seems to be intact. Now going to your shoulders. Alright, down. Alright, still feeling for decap BTLS. Now we're going to palpate the abdomen. Alright, so no signs of rigidity or tenderness. So now I'm going to go to your lower extremities. Alright, I'm going to do the right leg, which is the one that shot, so I'm going to be very careful. Alright, so that's very tender right there. Okay, checking for a dorsal pulse. It is very weak and thready. Going to the next leg, palpating it for decap BTLS. Alright, doesn't seem to be any pain. Just checking for another pulse. Still very weak and thready. Okay, checking the pelvis. Press down and in. Alright, no pain there, and I have checked the genitalia, and that is all good as well. So now I'm going to check the upper extremities. So I'm going to palpate. So there seems to be slight bruising and tenderness, probably from the fight. So we are going to wrap that up so it can't get hurt, okay?
Thanks.
Alright, so can you please squeeze my fingers? So she can squeeze a little bit. Can you tell me what finger I am touching?
The marriage finger.
Okay, I'm touching the pointer.
Oh.
Alright, so going to the other arm. Alright, doesn't seem to be any pain. Alright, can you please squeeze my fingers? Alright, good. You can do that. Alright, can you please tell me what finger I'm touching? Alright, good. Alright, so to recap, she had a GSW to her right leg. I applied direct pressure and tourniquet on it, and the bleeding has stopped. She has slight bruising and tenderness on her right wrist, probably from the fight. Her oxygen has gone up. The pulse ox now reads about 94, so that's good. And I will be rechecking her vitals every 5 minutes.